Do you know fever is not a disease? It's a protective mechanism. How? This is because fever activates the body's immune system to make more white blood cells, antibodies, and other infection-fighting agents. The rise in body temperature is indication of something wrong inside the body. In adults, fever is a first sign of illness, while in children a spike in fever occurs due to vaccination or due to a mild infection such as flu, cough, etc. Let's diagnose the fever by undergoing few questions. Firstly, the physical examination that you will do to the patient suffering from fever by checking patient's vital signs such as temperature, blood pressure, pulse, and other complete examination including weight of the body, ear examination, neck examination for stiffness, head examination for sinus tenderness, looking the throat, enlarged lymph nodes, chest, and heartbeat with stethoscope and pushing abdomen. Now let's moving forward to the questions that you need to ask your patients. Besides physical examination, if your patient is a child, try to know that when the temperature of child body was taken, whether the child was wearing excessively warm clothes or child has undergone any vaccination within past 3 days, because a spike in fever can occur in response to vaccination. Thirdly, you will ask your patient if he is taking any medication, including steroids, because one of the functions of steroid is to suppress the immune system, which places you at higher risk of infections and symptoms of infection such as fever. Other questions that help you in differential diagnosis of fever is that ask your patient if he has recently been traveled to any other country, or may bite by a tick within past 2 weeks, or had come in contact with patients suffering from tuberculosis, pneumonia, cold, or flu. Now, moving towards the family history that you will take from your patient, such as valvular heart disease, diabetes, tuberculosis, mononucleosis, AIDS, positive tuberculin test. You will ask your patient about shaking, chills, weight change, night sweats, headache, stiff neck, ear pain, sore throat, chest pain, cough, sputum production, trouble breathing, abdominal pain, urinary frequency, pain or difficulty urinating, crying on urination, dark urine, bone or joint pain, skin rash or pustules. Now we are going to discuss the causes of fever and their typical symptoms in detail, both in adults and children. Let's have a view of the common causes of fever in adults first. And it includes upper respiratory illness, mononucleosis, flu syndrome, urinary tract infection, drug fever. First cause is upper respiratory illness. What is it? It's a cold. What are the typical symptoms of upper respiratory illness? So typical symptoms of upper respiratory illness are sore throat and runny nose. Moving to the second cause of the fever in adult, and that is mononucleosis. What is mononucleosis? It's a flu-like illness caused by Epstein-Barr virus. What are the typical symptoms of this disease? These typical symptoms are sore throat and fatigue. Moving forward to third cause of fever in adults, and that is flu syndrome. What is flu syndrome? Conditions that produce flu symptoms, but that is not necessarily the flu. What are the typical symptoms of flu syndrome? So, the symptoms of flu syndrome are muscle aches, mild fever, malaise, loss of appetite, vomiting, diarrhea. Are you familiar with the term malaise? It's a general feeling of discomfort, illness, or lack of well-being. Fourth cause fever being the urinary tract infection. What is a urinary tract infection? It's an infection of bladder or urethra. What are the symptoms of urinary tract infection? So the main symptoms of urinary tract infection are sometimes blood in urine, frequent urination, difficulty in pass the urine, and pain in the sides. Moving to last common cause of fever in adults, and that is drug fever. Let's understand what drug fever is. It's a fever due to reaction to a drug. What are the symptoms of drug fever? So the symptom of drug fever is sometimes skin rashes. Now we are going to discuss causes of fever in adult that are less common and are serious, and that are pneumonia, meningitis, intra-abdominal abscess, cancer, AIDS, osteomyelitis, septic arthritis, tuberculosis, connective tissue disease, bacterial endocarditis, thrombophlebitis, Rocky Mountain spotted fever, tropical infections. First serious and less common cause is being the pneumonia. What is pneumonia? Pneumonia is inflammation of lungs. What are the typical symptoms of pneumonia? So, let's discuss the symptoms of it. These are chest pain, cough, and coughing of green or yellow material. The second serious and common cause of fever in adult is meningitis. What is meningitis? Meninges are covering of brain, so it's an infection or inflammation of covering of brain. What are the typical symptoms of meningitis? The typical symptoms of meningitis are stiff neck and headache. Do you know? Meninges are covering of brain and spinal cord. It consists of dura mater, arachnoid mater, and the pia mater. Do you know inflammation is also protective response? It has 4 cardinal signs. These signs are rubor means redness, calor means heat, tumor means swelling, and dolor that means pain. Moving to third serious and less common cause of fever in adult, intra-abdominal abscess. What is intra-abdominal abscess? Due to infection, there is collection of pus within abdomen. What are the symptoms of intra-abdominal abscess? Its symptoms are abdominal pain, mass in abdominal, and tenderness. Other cause being the cancer. Cancer is abnormal division and growth of cells. Its symptoms are masses, weight loss, and fatigue. Let's discuss some less common and serious symptoms of fever in adults. AIDS is one of them. It is caused by infection with HIV, and it's the disease of immune system. Its typical symptoms are fatigue, weight loss, and masses. Moving forward to osteomyelitis, it's also cause of fever in adult. It's an inflammation of bone. Its typical symptoms are muscle spasms, bone pain, tenderness, and swelling. While septic arthritis is inflammation of joints, its typical symptoms are swelling of the joint. Other causes include the tuberculosis. What's a tuberculosis? It's an infection that can spread throughout the body. It mainly affects lungs. Its typical symptoms appear when a person comes in contact with infected person, and these symptoms are chill, fever, night sweating, weight loss, cough. Fifth last cause of fever in adult is connective tissue disease. In this disease, tissue that binds or attaches joints and other tissue is diseased. Its symptoms are joint pain, chest pain, headache, and skin rashes. Fourth last reason being the bacterial endocarditis. It's a bacterial disease that causes inflammation of heart. So, the symptoms of this disease are difficulty in breathing, history of valvular disease, small red or purple spots. Thrombophlebitis is third last cause of fever in adults. It's an inflammation of the veins. So, its typical symptoms being the pain in leg, swelling. Rocky Mountain spotted fever. It's a disease transmitted by ticks. Its symptoms include tick bite and headache. The last, less common and serious cause of fever in adult is tropical infections. What is a tropical infection? As name suggests, it's more common in tropical area. It includes disease such as malaria, leishmaniasis, chagasticase. So, let's have a discussion of symptoms related to tropical infections. Person traveled to tropical area. Symptoms of malaria such as cold, weakness, fainting, jaundice. Do you know what is malaria? It's a human disease that is caused by sporosome parasite in red blood cells, and its vector is a female mosquito and characterized by periodic attacks of chill and fever. Leishmaniasis is a parasitic disease and spread by the bite of sandflies infected with the protozoa Leishmania. It has many forms, most common being cutaneous and visceral leishmaniasis. Chagas disease is caused by Trypanosoma cruzi, and the symptoms change over the period of infection. Now, moving to the cause of fever in children and its typical symptoms. It includes the wearing excessively warm clothing, bacteremia, rosola, measles, rheumatic fever, scarlet fever. Too much clothing results in increase of body temperature. but temperature becomes normal when clothes are removed. The second cause of fever in children is bacteremia. What is it? Bacteria in blood. What are its symptoms? Common in children younger than 2 years. High fever with no source of infection. Third cause of fever in children being the rosola. It's a disease with appearance of red spots and fever. Its symptoms are fever that lasts for 3 days, pink rashes on 4th day. Child is otherwise well. Fourth cause of fever in children is measles. It's a highly contagious disease. It's viral disease. Symptoms are pink eye, appearance of white specks in mouth, cough, and fever. Fifth cause of fever in children is rheumatic fever, rheumatic arthritis. What is it? It's a recurrent joint problem. Its symptoms are fever and joint pain. Last cause of fever in children is skin infection, scarlet fever. What is it? Often rashes are produced in this disease and infects the skin. What are its symptoms? Skin rashes, pustules, collection of pus on skin. As major causes and their typical symptoms are discussed in detail above. Now, let's have view of mechanism of fever. Introduction of pyrogen leads to tissue damage, causes monocyte activity that causes of production of interleukin-1 and interleukin-6, interferons and tissue necrosis factors that stimulate the production of prostaglandin E2 that resets the hypothalamus. After a detailed discussion of what a fever is, its causes, and its mechanism, we are going to have an overview of what we have discussed in this topic. So fever is a protective mechanism. Moving to diagnosis, you will have a physical examination of a patient and ask few questions. Moving to its causes and typical symptoms, both in adult and children. So in adult, its common causes are upper respiratory illness, mononucleosis, flu syndrome, urinary tract infection, drug fever, and causes of fever in adult that are less common and are serious, and that are pneumonia, meningitis, intra-abdominal abscess, cancer, AIDS, osteomyelitis, and others. While the cause of fever in children are the wearing excessively warm clothing, bacteremia, rosola, measles, rheumatic fever, scarlet fever. So that was all about today. Keep following sqadia.com for more such videos.